Hi everyone, I'm going to give you a whistle-stop update about the Institute. It was going to be whistle-stop anyway because we're limited for time, but we're going to try and do a bit of catch-up. But obviously if you want any further information about the Institute, please get in touch following today or during today, and we'd be more than happy to talk to you about ourselves. It's our favourite subject. So just about the Institute, we've 26 partners who are very appreciative of, and many are represented here in the room today. So we've 9 hospices, 9 universities, 5 health and social care trusts, 2 charities and the Public Health Agency. As well as our partners, we also have a range of funders. I won't pick any out, don't want to show favouritism, but obviously we're very appreciative and grateful to them for their support, as we are with our partners. The Institute has a key role in brokering relationship, both with our partners and wider stakeholders within the health and social care system in both jurisdictions, in the Republic of Ireland and Northern Ireland as well. In terms of our work programmes, at the end of 2015, when there was agreement that the Institute should continue, the partners and stakeholders came together and agreed on these work programmes, which are to integrate palliative care across the health and social care system, so rolling out that kind of palliative care approach that is not just about specialist palliative care. As we've already reflected on, partnering with users, carers and communities. So one of our key vehicles is Voices for Care, as we've already mentioned today for that, and continuing to support the development of specialist palliative care. In terms of the team, we're small and beautiful, I'd like to think, but obviously I'm highly biased. The aim of the Institute is to work with our partners and stakeholders to improve the palliative care experience for people with life-limiting conditions. With our business plan, we've kind of split this into different areas. So in research, I'm not going to steal Joanne's material, which is going to come up in a second, but obviously our main vehicles are of this very network, the Palliative Care Research Network, the Early Career Research Forum, and we have a focus on supporting our researchers with funding, knowledge transfer, ensuring that research informs policy and practice and education and vice versa. Very keen on that, and service user and carer engagement, and obviously linking in with international networks. Service user, carer and community engagement, as I've already mentioned, Voices for Care is our main vehicle for this, and we currently have a panel of 41 members from across the island. Later in this year, we'll be looking to refresh the membership into next year, but very much informing our work, the work of our partners, and the work of the palliative care sector and researchers by various mechanisms. We also we've had 2 years of developing palliative care experience videos with support from the HSC and the Public Health Agency in Northern Ireland, and they're a great tool. There's an example there from Billy Riley, and they're a great tool for using in education, and they're available on our Palliative Hub adults and children as well. So very much recommend those to you. In terms of education, our role is very much around supporting our partners with delivering palliative care education. So we have a wide range of different initiatives and my colleague Cathy Payne leads on this programme, a wide range of different ways which we do this, through developing online education, by looking at postgraduate education, and we're due to roll out 2 further rounds of Project ECHO AIIHPC, one for nursing homes and one for AHPs for physio and OT. They'll be being rolled out and evaluated early next year. Policy, linking up with government departments and agencies, is kind of our key, and the clinical programmes in both jurisdictions. So obviously, policy is very important to us, as is practice. And again, one of our main ways in which we do support practice is by hosting and supporting a number of workshops and conferences. And we've already in the planning stage for a number of workshops in early 2019, so we will be advertising those to you and hope you can attend. Finally, the Palliative Hub, which is an online gateway to information about palliative care. We have 2 public-facing sites, the Learning Platform, which is for online learning, Palliative Hub Professional, which is where the resources for education, research, and the national guidelines all reside. So palliativehub.com is the main landing page, but it kind of separates into those various sites. Palliative Care Week is, we've had the 5th year, and every year it continues to grow. It's focused on raising awareness. As we were just kind of talking in this, it's very much focused on raising awareness of the benefits of palliative care for people with life-limiting conditions. Every year we continue to grow. Palliative Care Week, and we're already in the early stages of planning for 2019. So I'd like to take this opportunity to thank our partners and yourselves for rowing in and supporting us, because without the support of partners and stakeholders, you know, it wouldn't be the success it is. And I would say, if anyone's got any great ideas for how we can build on it in 2019, please get in touch. We're always open to ideas. In terms of key achievements, Voices for Care, it's been going since 2013. You know, it's a key strand of our work, so we're very appreciative to the members for their contribution to the Institute and our partners. Research, obviously the establishment of the Palliative Care Research Network and the Early Career Research Forum is like a key achievement for the Institute, and something that we're very proud of, being able to support and work with researchers in this vitally important area. Education, the Institute heavily supported, and as Michael Conley's in the audience, Michael heavily supported the development of the Palliative Care Competency Framework, which has been held up internationally really as a guide to developing this kind of work, and we have a network of educators, and we're looking to put a conference on in the first quarter of next year with UCD on that. Policy, we've developed good relations, or I hope they're good relations, with the government departments and agencies and clinical programmes in both jurisdictions, and obviously that's something we want to continue to maintain. Practice, supporting conferences and workshops on the island, and we had 2 rounds of the Palliative Care Senior Nurse Network. The Palliative Hub, very proud of developing that resource, and obviously keen if people have ideas how that can be improved. We're always open to those ideas, but we need to build and grow those resources. Palliative Care Week campaigns, we've had 5, and as I mentioned, we'll be continuing on with that. And we are continuing to raise awareness of the Institute, both on the island and internationally. But obviously on the island, it's important that clinical staff and researchers know about the Institute and know about the ways in which we can support their work. So that's work in progress. It takes time to trickle down, but we're giving it a good go. And I suppose in terms of sustainability and growth, we've expanded our partner base. So when the Institute was first established in 2010, there was 12 partners, and I'm proud to say now there's 26 partners, and we're still have our eye on expanding to further partners as well into the future. And we've moved our funding base. Originally we funded with the majority of our funding came via Atlantic Philanthropies, and we've moved now to a wider funding sources. That's a whistle-stop tour. Hope I wasn't too garbled in that delivery. I now have the great pleasure of introducing the Institute's new chair, Vincent Fagan, who's going to say a few words for us.
Thank you, Karen. Good afternoon, all. Thank you for the opportunity to speak at this important symposium. As the recently appointed chairperson of the All-Ireland Institute of Hospice and Palliative Care, and I really like the All-Ireland Institute. It's a really great organisation to be part of. I've had the privilege of meeting with Karen and all the All-Ireland Institute team, whose dedication to advancing and improving palliative care across the island of Ireland is inspirational. Dame Cecily Saunders recognised the inadequacy of the care of the dying. So often patients and families were told that there was nothing more that could be done, a statement that Dame Cecily Saunders refused to accept. Throughout her time at St. Christopher's, her watchword was, "There is so much more to be done." Dame Cecily Saunders' pioneering research and vision is lived out today through you all, and particularly through the Palliative Care Research Network, which enables and supports collaborative palliative care research to improve care by changing practice and policy. The research network is an essential and vital strategic asset for all the partners, and I feel particularly passionately about that. One of the things I would say, having sort of come into the Institute and been working in palliative care about 20 years ago, and then coming back in and working for the last 3 years, I think within our individual organisations, we don't recognise the Institute enough. It doesn't appear on our annual reports. It's not on the agenda of the boards within the organisations. And one of my objectives will be to ensure that that happens. Because what happens is the partners fund it, and there's a conversation once a year about, the invoices in from the Institute, what do we do about that? So what I'm hoping is that the organisations will have it on its agenda, because there is no way we could pursue the palliative care agenda pursued by the Institute as individual organisations. So it is an absolute asset. And as I said, as individual organisations, we could not hope to achieve the successes of the All-Ireland Institute and meet the current and emerging demands from the health system. The demands that we all face day to day, whether it's reporting on KPIs, whether it's managing budgets and managing all of those, unfortunately, research and education gets deprioritised in the midst of all of that. So it's thanks to the All-Ireland Institute being there that research and education gets prioritised. The only way to continue to integrate care, research and education and practice development across the island of Ireland is through each partner passionately supporting the work of the Institute. I would like to sincerely thank all the partners for their support, both strategic and financial. And through the various committees and through the various forums, all of the partners involved support the Institute, particularly on a strategic perspective and, very importantly, on a financial perspective. I'd like to ask you to do something following today's symposium when you return to your organisations. I would ask you to talk to your colleagues about the work of the Institute and the importance of the Palliative Care Research Network, and even to share John's story here today and to have those conversations right throughout the organisation. Perhaps you could recall Dame Cecily's battle cry to inspire your colleagues, "There's so much more to be done." And listening to the presentations to here today, there is so much being done, but there is so much more to be done. I would like to finish by thanking Karen and the team for organising today, and I'd appreciate if you could join me in giving them a round of applause.